afternoon. This presentation will talk about the abuse of stimulants. The purpose of stimulants in the treatment of ADHD. We will discuss how stimulants are the most commonly prescribed medications for ADHD, especially among children and adolescents. Methylphenidate in particular, as well as other stimulants, can help manage the core symptoms of ADHD, like inattention, hyperactivity, etc. These medications increase dopamine and norepinephrine levels in the brain. The overview of methylphenidate particularly is often recognized by its trade names like Ritalin or Concerta, and is widely used as a first-line treatment for ADHD. And it is a central nervous system stimulant that has been shown to improve focus and behavior regulation. Methylphenidate's efficacy in reducing ADHD symptoms is well documented, making it the preferred choice by clinicians. It has a rapid onset and is particularly useful for managing symptoms during school hours. Other common stimulants are Adderall, dexmethylphenidate is frequently used. Amphetamines have similar mechanisms, um, uh, and dexmethylphenidate is a derivative of methylphenidate. Um, the effectiveness and safety studies consistently show that stimulants like these improve symptoms in children and adolescents with ADHD, but they also come with potential side effects like sleep disturbance, reduced appetite, increased heart rate. So generally they are safe when used as prescribed, but clinicians need to monitor patients closely. The origins of use and misuse of methylphenidate was in the 1950s for the treatment of ADHD and other conditions. Its use in treating ADHD became more widespread, and also reports of misuse. And by the 60s, cases of recreational use and non-prescribed use of methylphenidate were being documented, as some users sought the drug stimulating effects for purposes outside of therapeutic intentions. The rise in abuse rates in recent decades, including methylphenidate, has notably increased, and this trend especially has been prominent among adolescents and young adults who often misuse these medications to improve focus, energy levels, and academic performance. The contributing factors are that the perception of ADHD meds like methylphenidate as performance enhancers contributes to their misuse. And there's also increased availability online, which is not great. And many users believe that these meds are relatively safe due to their legal status and therapeutic use, which often leads to a misunderstanding of the risks associated with non-prescribed use. The misuse of stimulants remain a significant concern in healthcare, and the misuse rates highlight the need for responsible prescribing practices and also better education on the risks of non-prescribed use. Current prescribing guidelines recommend close monitoring of patients, especially adolescents and young adults, to minimize the potential for misuse. In the United States, the distribution and use of stimulant medications like methylphenidate, amphetamine, and dexamphetamine have risen significantly over the past 10 years. And recent studies reveal pronounced regional variations, with the highest rates of stimulant prescriptions found in the southern and Midwestern states. These regional differences are influenced by local prescribing practices, healthcare access, and public attitude toward ADHD treatment. Overall, stimulant use has expanded across all age groups, with particularly high healthcare access, and public attitudes. Particularly high prevalence among children and adolescents diagnosed with ADHD. High-risk populations for stimulant misuse are mostly among adolescents and young adults due to academic pressures and the perceived benefits of these drugs that they think can help them concentrate and improve their performance. And many young individuals use these stimulants as study drugs, which can lead to patterns of misuse and dependency. Another vulnerable population includes older adults, 50 and above, especially those who have histories of substance misuse or mental health disorders. And this population could misuse stimulants intentionally or accidentally, often co-using with other substances that can compound the risks. Key factors are academic and social pressures that are common motivators, um, and potential consequences are the misuse of stimulants like methylphenidate, which can lead to serious health issues, including cardiovascular strain, dependency, adverse outcomes when combined with other substances, like I mentioned. Both of these populations benefit from targeted education and monitoring to prevent misuse and reduce the risk of negative health outcomes. There are short-term and long-term side effects that I will talk about with stimulant medications like methylphenidate that produce several immediate side effects. Some common ones are insomnia, reduction in appetite, um, which affect a lot of children and adolescents. And also, stimulants elevate your heart rate and blood pressure, making it essential for healthcare providers to monitor these parameters really closely. Some people might also experience mood-related changes such as irritability, anxiety, or even aggression, especially when first starting the medications. Some long-term side effects over a long period of time. Stimulant use has shown potential risks that warrant careful consideration, especially in younger populations. One concern is its potential impact on growth, as stimulants may slow growth rates in children. Long-term stimulant use has also been associated with cardiovascular risks, although the data is mixed and requires further study. Additionally, some patients might experience cumulative emotional and behavioral changes like more irritability and mood swings. So these are something that healthcare providers need to follow up on. People misusing stimulants often exhibit significant behavioral changes, and this can include increased agitation, impulsivity, and noticeable mood swings. And they might also display secretive behavior, possibly in an attempt to conceal their use of stimulants. Also, some users might suddenly change their friend groups or social activities, particularly if their new circle enables their drug use. Physical symptoms include things that are hard to miss, like rapid weight loss, decreased appetite, are common because these drugs suppress hunger. Other physical symptoms could include insomnia, sweating, an elevated heart rate, which can lead to more serious cardiovascular complications over time. Cognitive and emotional changes of stimulant abuse can impact cognitive and emotional functioning, and people might develop paranoia, have heightened anxiety, or even have hallucinations uh, if the use is severe. There can also be difficulty concentrating or memory issues that emerge over time and interfere with daily responsibilities and tasks. The potential for overdose and suicide attempts with stimulants is there. Methylphenidate and other stimulants have a known risk of overdose, especially in cases of intentional misuse. Overdose often results from taking higher doses than prescribed or combining the stimulant with other drugs. Physical symptoms of stimulant overdose include severe agitation, hallucinations, and dangerous cardiovascular changes, which can lead to life-threatening conditions if these things are not addressed. The link to suicide attempts, intentional misuse of stimulants like methylphenidate has been documented in suicide attempts, really among older adults, especially over 50, as shown in recent research. This demographic might misuse stimulants to self-medicate or cope with mental health challenges, which increase the risk of intentional overdose. And when stimulants are combined with other substances like alcohol or opioids, the risk of fatal overdose is amplified due to the the additive toxic effects on the central nervous system, which create a high risk situation for severe or fatal outcomes. Here's an example of a care plan for somebody who has stimulant abuse disorder. So the pharmacological treatment options can play a role in the treatment of stimulant use disorder, um, though they are often used adjunctively. Medications like bupropion and naltrexone have shown potential in reducing cravings and managing withdrawal, though their efficacy is variable. Individual response should be monitored closely, as some patients benefit more from non-pharmacological approaches, such as behavioral therapies like CBT, which are widely recommended for stimulant use disorder. CBT can help patients identify triggers for stimulant use and build coping mechanisms to manage stress and cravings. Um, let's see, what else? Evidence indicates that behavioral approaches are really important in long-term management of stimulant dependence, and are often more effective than pharmacotherapy alone. The education part is crucial. Also, educating patients on the risks associated with stimulant use is really important for enhancing motivation to adhere to treatment. Information about relapse prevention strategies, the negative health impacts of stimulant use, and the benefits of CBT and pharmacotherapy can help patients make informed decisions about their care. Referral to specialized addiction services or an addiction counselor can provide comprehensive support and improve the likelihood of recovery. These programs often include both group and individual therapy sessions, which help patients to develop a strong support network. Frequent follow-up visits are important to monitor progress, providing ongoing support and adjust treatment as needed. Scheduling follow-up every 2 weeks helps healthcare providers to assess the patient's adherence to the care plan, address any challenges, and offer encouragement to continue with both pharmacological and behavioral treatments. So to conclude, we talked about a comprehensive approach to for effective management of stimulant use disorder. Um, we talked about the importance of patient education and support to help with relapse prevention. We talked about ongoing monitoring and collaboration and how taking a multidisciplinary approach to this patient population is really important. And we talked about a path to recovery and that it is possible with structured treatment and a really good support system. And we can help our patients overcome stimulant use disorder. Thank you so much.